Hi, everybody. Welcome. This is our second installment of our three-part wellness webinar series. I'm Larissa Bedrick. I'm our communications director for the American Heart Association here in Central PA. And on behalf of our entire team, thank you so much for joining us today. Our presenters today have a lot of great information to share that I hope you'll be able to use and even share with some others who may not have been able to join with us today. So I encourage you to take notes if you need to. And if you're on social media, share some of what you learned there too. You may have some friends who might be interested. So feel free to tag us. We're at AHA Central Pennsylvania. AHA Pennsylvania on Facebook, Twitter, and Instagram. And you can follow us also to stay up to date. We have a final wellness webinar coming up in December and some other happenings in our region. So be sure to follow us there. And our webinar series today is supported by several generous sponsors, including UPMC, Encompass Health, Traditions Bank, Visiting Angels of York, and the Markets at Hanover. We really thank them for allowing us to bring this event to you and for supporting our mission here in York County and beyond. And today, you're all here to hear us talk about diabetes prevention. And so why is the American Heart Association talking about diabetes? That's because diabetes is a major risk factor for cardiovascular disease, and good nutrition, adequate physical activity, two things we're talking about today, they play a big role in preventing and managing both cardiovascular disease and diabetes. So today we have two experts from UPMC Hanover, Denise Stam, a dietitian, advanced practitioner, and Brady Slater, who is medical fitness and employee wellness coordinator. First off, it's my pleasure. We're going to introduce Denise Stam. Denise?
Oh, thank you so much for the kind introduction. I'm going to work on sharing my screen and we'll get started. Are you able to see my screen?
Yes, we can see your screen. Thank you so much.
Excellent, excellent. Well, please feel free to ask any questions in the chat box, and I will do my best to watch that as I am speaking. However, we'll have a few minutes at the end of my presentation for me to answer any of your questions. So the first question comes about as far as, well, what is diabetes? Well, diabetes is a chronic disease characterized by high levels of sugar in the blood. There's several types of diabetes, but type 2 is probably the most common type of diabetes and may also be called adult onset diabetes. Now, typically this presents in the middle to late adulthood. However, unfortunately, more and more children are developing type 2 diabetes. There are plenty of risk factors for diabetes. Weight certainly does have something to do with it, especially if you carry your excess weight around your middle or your waistline. Having a family history of diabetes also puts you at higher risk. So if you have a brother or sister with diabetes, or your mother or father, or even your grandparents, that family history of diabetes can put you at higher risk. If your blood pressure is elevated, that's a risk factor. So is low HDL cholesterol, and HDL cholesterol is the good cholesterol, and high triglycerides can also put you at higher risk. If you had gestational diabetes, the type of diabetes that occurs during pregnancy, that type of diabetes in pregnancy can increase your risk for type 2 diabetes down the road. Also, there are several ethnic groups that have a higher risk of type 2 diabetes. When we talk about the symptoms, there's a lot of symptoms of diabetes, and I'll go through these. However, because type 2 diabetes happens so gradually, a lot of times people really either don't see the symptoms or they miss the symptoms and realize it kind of afterwards. So excessive thirst is a symptom. Going to the bathroom very frequently. If you lose weight without trying, that also is a symptom of diabetes, because you're eating food, but that nutrition isn't getting into your body because you don't have enough insulin to do its job to let that nutrition enter the bloodstream. Extreme hunger, sudden vision changes, tingling or numbness in the hands and the feet, and being tired all the time. But like I said, a lot of people don't have any of these symptoms or really don't recognize them. The way that diabetes is diagnosed is actually through blood testing. And there are several types of blood tests out there that your doctor could use to diagnose diabetes. The first blood test is called a hemoglobin A1C. So you can see on your screen 3 different arrows there. The arrow that you'll see there on your left, it says A1C. So an A1C is based on your red blood cell. The red blood cell, when you have too much sugar in your bloodstream, becomes glycosylated, and that can be tested through blood work. When a doctor does that type of testing, it's looking at your blood sugar during the last 3 to 4 months. And by looking at that number, the doctor can tell if your blood sugar is high enough to be considered in the diabetic range. So below 5.7 is considered normal. We have 5.7 to 6.5 to be pre-diabetes, and over 6.5 would indicate a diagnosis of diabetes. We also have another blood test, the one there that's in the middle, called the fasting blood sugar. And that pretty much means if your blood sugar is checked first thing in the morning after a period of fasting, depending on what the number is, that would be another way your doctor could determine if you have a diagnosis of diabetes. So less than 100 would be normal. Range between 100 and 126 would be considered pre-diabetes. Greater than 126 would be considered diabetes. The last test on your screen, you can see there that last arrow, that's called an oral glucose tolerance test. And even though that is a test that can be used to determine whether there is a diagnosis of diabetes or not, we don't tend to see that blood work done quite as frequently because it is a lot more time consuming. It involves drinking a very high sugar drink with 75 grams of glucose, and then going back 2 hours later to find out what your blood sugar is. So again, there are some ranges there. The green, less than 140, shows a normal blood work. 140 to 200, pre-diabetes, and greater than 200 would be a diagnosis of diabetes. So those are some ways that the doctor can determine whether you have diabetes or not. And why do we care so much from a heart health standpoint? Well, unfortunately, high blood glucose can damage blood vessels and raise blood cholesterol. Too much fat and cholesterol in the blood vessels can block or reduce blood flow to the heart. So really, we want to work on prevention to the best of our abilities. And if you do have a diagnosis of diabetes, we want to do our best to manage blood sugars and keep the numbers within a target range. There's a lot of things we can do to minimize our risk of diabetes. One of them is making changes in the diet, which I'm going to focus on today. We'll spend a little bit of time on weight reduction, and then Brady's going to talk a lot about physical activity and some things that you can do to minimize your risk of developing diabetes through physical activity. But one of the big things that we can do is look at the type of carbohydrates. Unfortunately, right now, carbohydrates are getting kind of a bad rap in the American diet. We're seeing a lot of diets really making carbohydrates the villain. And we do need carbohydrates. Carbohydrates are the best source of energy for our body. So it is really important that we have carbohydrates on a daily basis and several times a day. So when we look at carbohydrates, choosing the whole grains and whole grain products over refined grains and other processed grains. So a whole grain pretty much looks like this. You can see the whole grain has a bran shell around the outside, and this bran is filled with a lot of fiber. It has B vitamins, it has minerals, and then we have the middle part of the whole grain, and that's where the germ is. So if you remember many years ago, people were using wheat germ and sprinkling it on yogurt and baked goods. They were working to get more B vitamins, more vitamin E, more phytochemicals, and healthy fats. So when that grain is refined, it takes off the outer shell, it takes away that bran, and it also takes away that germ and leaves only the middle part, which is the starchy carbohydrates. So this would kind of be the difference between a whole grain bread and a refined white bread. So we're trying to minimize our refined grains. Refined grains would also come in a lot of different types of snack foods. Maybe some baked goods would also be considered types of refined grains. So when you choose carbohydrates, which I mentioned earlier, are really going to be a helpful item as part of your diet, we want to focus on the whole grains rather than the refined grains. Another thing, another food that's considered a carbohydrate is sugar. Sugar is a type of carbohydrates. All carbohydrates provide the same number of calories in the diet, but the way they work in health is very different. Unfortunately, sugary drinks like lemonade, soda, some of the other things here, this type of carbohydrate, a high sugar intake, is really something we're trying to limit in the diet. The American Heart Association really is focusing on sugar. Even if you don't have a diagnosis of diabetes, and for diabetes prevention, we're encouraging people to limit their added sugar to no more than 100 calories per day, which is about 6 teaspoons for ladies, and no more than 150 calories per day, which is about 9 teaspoons for men. So to put that into perspective as far as what does that number of teaspoons look like in food, if you can visualize a can of cola, and there's many popular brands out there, so a can of cola has almost 3 tablespoons of sugar. And if you remember back to your home ec days, there's 3 teaspoons in a tablespoon. So that 1 can of cola can easily meet or even exceed the sugar recommendation. And also remember, we get a lot of added sugar in other items other than those beverages. So things like sauces, baked goods, those beverages that we mentioned, it is very easy to get a lot of added sugar in your day. What's really important to know is there's some ways that you can really replace some of that sugar. So one is to enjoy fruit for dessert on most days, and limit those fun higher sugar desserts to special occasions or to holidays. Cut back on the amount of added sugars that you eat and drink. You can enhance foods with a lot of spices. There's a lot of spices out there that really taste a little bit sweet, but don't have any added sugar. Some of those would be cinnamon, nutmeg, and those type of spices really remind me of fall. So think of all those pumpkin spice type spices. Mint or ginger are 2 other spices that can really mimic that sweet flavor. If you're one that adds sugar to cereals, you can try adding some fresh or some dried fruit. As far as beverages, of course, plain water. But if you do add sugar to a tea or a coffee, you can always reduce the amount. So again, a lot of ways to make things taste sweet without adding a lot of added sugar. the label will be a very helpful place for you to find the added sugar. You can see on the label, we have two different labels listed here. The label that has the circles around it is the more current label. The old label, which you'll see there on your left, puts the sugar information and it groups all the sugars together. So if a food has natural sugar, like the sugar that's in milk, or if it has a natural sugar, like the fruit sugar, that is all included in that one area where it says sugars. However, on the more current label, you can see there's information there on total sugar, but that total sugar is broken down into added sugars. So that part of the label, you can see that this product that I have on screen includes 10 grams of added sugar. So using the label can really be a helpful tool if you're trying to reduce added sugar in your diet. And just kind of a quick conversion, 1 teaspoon of sugar has 4 grams of sugar or 4 grams of carbohydrates. So you can use that information to make some better choices when you're looking at the food label. Another big way we can reduce our chances of developing type 2 diabetes and heart disease is to look at the type of fat that we're eating. Fat, just like carbohydrates, is an important part of our diet. And just as we mentioned in the carbohydrate group, there's going to be some fats that are going to be more healthy for our heart than others. So when we look at the types of fat, we have saturated fat, we have trans fat, we have polyunsaturated fat, and monounsaturated fat. Now, keep in mind, all these fats have the same amount of calories and the same amount of fat. It's really how these fats impact our heart health. The recommendation for fat in the diet is 30% of the calories or less per day. I'd like to take a minute or two to talk a little bit about the different types of fat, where we find them in the diet, and how we can make some changes to maybe swap the type of fats that we're choosing. So the type of fat that tends to raise our total cholesterol and our LDL cholesterol is called saturated fat. And just to help you remember, what does that LDL stand for? So think of that first L in the LDL as the lousy cholesterol. So LDL, that's your lousy cholesterol. That's the cholesterol that we want to be lower. So these type of saturated fats are found in animal products. Like think about the fat that's in various types of meat, like the skin that's on chicken, and the fat that marbles red meat and is throughout red meat, milk and cheeses that are made with a whole milk, butter, palm and palm kernel oil, and coconut oil. And these type of oils and fats tend to raise blood cholesterol. As far as saturated fat, it's going to be impossible to totally eliminate saturated fat from your diet. All foods that contain fat contain some of each type of fat, but we're primarily focusing on the foods that are the highest in saturated fat. And as far as recommendations, again, you're going to get some saturated fat in your diet, and we're looking at about 7% of your diet calorie-wise should be coming from saturated fat. When we look at trans fat, these are fats that are found in foods that contain partially hydrogenated oils. This is when they take an oil that's liquid at room temperature and make it semi-solid through a hydrogenation process. Unfortunately, these types of fats are really not good for heart health. Again, they're going to increase the LDL level, which is your bad cholesterol. Keep in mind when you're looking at the label, and there is a spot on the label to show you how much trans fat is in a product. With this type of label, it's going to be able to round the number down. So if a food has 0.25 grams of trans fat, the manufacturer can round that number down to 0. So if you're concerned about limiting trans fats in your diet, looking at the ingredient label would be your best bet. You can check to see if that food has any partially hydrogenated vegetable oil, and that would indicate that there is some trans fats in that product. And really the goal is to keep that trans fat as low as possible in your diet. The next two types of fat are going to be more heart healthy. So this next one is called the polyunsaturated fat. And this is the type of fat that has little effect on your HDL, and it can lower your LDL. So in this group, you might have heard of the omega-3 fatty acids. That's where they lie. So if your doctor has encouraged you to eat more fish, especially the fattier fishes like salmon and mackerel, or if your doctor has you on a fish oil pill, that's the reason. It's a polyunsaturated fat that is considered an omega-3 fatty acid. If you're not a fish lover, there's also some other ways to get some polyunsaturated fats in your diet, and that would be walnuts and pine nuts, also flax seed oil and flax seeds, as well as sunflower seeds and sunflower oil. Another heart healthy fat is called the monounsaturated fats. This type of fat helps lower the bad cholesterol, which again is that LDL, and it also helps raise the good cholesterol, and that's your HDL. Some sources of monounsaturated fat would be avocado, olives and olive oil, and most nuts. So peanuts, cashews, pistachios, all those nuts are going to be good sources of monounsaturated fat. And our goal really is to switch things up a little bit. Our goal is to limit the saturated fat and trans fat and increase the heart healthy fats. So we're not necessarily looking at a fat-free diet, which you may be familiar with from many, many, many years ago, but we're embracing the fact that fat is really good for our bodies, but trying to swap out those saturated fats and trans fats for more of the heart healthy fats in the diet. So there definitely is a lot of good ways that you can decrease the unhealthy fats in your diet. Of course, eating more fruits and vegetables. Fruits and vegetables are naturally low in fat. They also have a lot of fiber, and fruits and vegetables are also some good examples of some carbohydrates that are going to have a lot of health benefits. Of course, eating more fish and more skinless poultry. When you do have the red meat choices, try to consume the leaner cuts of beef and pork. Trim as much visible fat as possible. You can choose some lower fat cooking methods like baking or broiling or grilling meats instead of frying. If you use dairy products, looking at the fat-free versions or the 2% milk versions. Limit hydrogenated fat like shortening, lard, and partially hydrogenated oils. And use those heart healthy fats. So again, we don't need to eliminate fats from our diet, but looking at things like olive oil, substituting that for different types of fats in the diet, using peanut butter and avocado. So a lot of great ways to incorporate some healthy fats into your day. We also find that losing a little bit of weight does help to reduce your risk of diabetes. So in one large study, people reduced their risk of developing diabetes by almost 60% by losing a little bit of weight. And in this particular study, 7% of their body weight, if they were able to lose that, that really did reduce their risk of developing type 2 diabetes. So just to kind of give you an example of what does 7% look like in terms of pounds. So if someone's starting weight is about 200 pounds, a weight loss of about 14 pounds, which would be 7%. So working on changes in your diet and losing a little bit of weight can really help to reduce your risk of developing type 2 diabetes. A couple quick tips here on weight reduction. Weight reduction takes time, and often we want a quick fix, but skipping the fad diets is probably going to be a good idea. What you really want to look at is ways that you can make long-term changes in your diet. Also, of course, set realistic goals. It does take time to lose weight, and a goal of 1 to 2 pounds per week, and sometimes even less as far as weight loss would be recommended. Get in touch with your appetite. Start feeling those hunger and fullness cues. Stop eating when you're starting to feel satisfied instead of when you're overly full. Of course, having a positive attitude and talking to yourself in a positive manner, I think, can also really increase your likelihood of reducing your weight. So how can we put all this information together on a plate? Utilizing the plate as a good visual can help you work on the balance. So we're looking at that section 1 there of the plate. So we took a plate and we divided in half, and then we took half of that plate and divided in half again. So we're looking at about half of that plate to be non-starchy vegetables. And when we talk about non-starchy vegetables, there are things like broccoli, carrots, spinach, onions, zucchini, asparagus, Brussels sprouts, cauliflower, salad greens, tomatoes. So all those type of things would fall on that half of a plate. The second part of the plate would be your healthy protein source. So that could be an animal protein, such as chicken or fish, but there's also a lot of plant-based proteins that are available to us as well. Those would be things like tofu. It would be things like the heartier beans, like kidney beans, garbanzo beans. So having a protein source there as the other quarter of your plate. And then that last quarter of the plate could be a high quality of carbohydrates. So we've talked about things that are whole grain. So quinoa would fall into this quarter of the plate. So would brown rice fall into this quarter. If you like pasta, a whole grain pasta would be part of this portion of the plate. Barley would be another example of a high quality carbohydrate. But high quality carbohydrate could also be one of the more starchier vegetables like sweet potatoes. So utilizing the plate, I think, is a good visual for incorporating all of those things that we talked about earlier. So hopefully I was able to provide a little bit more information to you on diabetes prevention through diet. So we do, I guess, have a moment for questions, and I think I do see one there. The question is, what are your thoughts on using products like stevia or Zing? That's an excellent question. So the answer to that would be, those would be a carbohydrate-free alternative to sugar. So I think, yes, that would be a good way of sweetening things without added sugar. There's a lot of those types of products on the market, and they are safe to use. So the stevia type products would be an alternative for you. Great question. Any other questions?
I don't see any other questions, but I see a great comment here. She's sitting there eating her lunch, some tilapia and rice vegetables. That sounds delicious.
There you go. Good choice. Good choice.
Yeah, hopefully this will influence some folks' lunch choices that they have coming up here, and they'll maybe pick a few healthier options to add to their lunch today.
Exactly.
So thank you, Denise, so much, and thank you for taking those questions.
You're welcome.
And again, if you have any other questions that come to mind as we move on, feel free to put those in the chat, and we can get those addressed for you later as well. So up next, it's my pleasure to introduce Brady Slater. He is UPMC Hanover's Medical Fitness and Employee Wellness Coordinator. Welcome, Brady.
All right,
Brady, oh, there we go.
I'm there.
Yeah, you're there.
And I am going to also share my screen, but I'm going to open. Can you see? No, you can't. Can you see my screen?
No, not yet. Denise may have to unshare first, I think.
Okay.
I can see him.
You're good now?
There we go. I can see it now. Thank you.
All right, so I am going to talk today about the benefits of fitness and physical activity and exercise, more specifically to the prevention of diabetes or maintenance of diabetes. For some reason, my PowerPoint moved from one of my screens to the other. I'm sorry. So now I'm looking one way instead of the other. The average person, actually, I'm going to try this again. I'm sorry. I'm not sure why. Are you still there?
Yeah, we're still here.
All right. I don't know why it did that, but it. All right, let's try this again. All right, there we go. I'm better now. Sorry. So what I'm here to do is I'm going to talk to you about physical activity and exercise, more specifically as it relates to diabetes prevention, diabetes management. Regular physical activity and exercise are the cornerstone for any healthy aging. Immediately upon starting an exercise program, you increase your energy levels, you have better sleep patterns, your anxieties are decreased, your mood is better, your blood pressure lowers, your self-esteem, your confidence in your day-to-day and completing your day-to-day activities are much more improved. Long-term, with long-term exercise and physical activity, we look at reducing your risk for developing diabetes. You're looking at reducing or better management of your diabetes. You lower your risk of heart disease, cancer, brain health. There's some really interesting stuff coming out now with exercise and cognitive and Alzheimer's and dementia. So there, in addition to now with all the COVID stuff going on in your immune systems and fighting infection or fighting illnesses, weight management is a big part of this, bone strength, fall prevention, and overall just quality of life. The problem is most Americans just are not getting the amount of physical activity that they need. More specifically, they're not getting the steps they need on a day-to-day basis. They're not getting the regular aerobic activity. They're not getting the strength training. Some of the statistics show that it's around 50% of the US population meets the basic guidelines for aerobic. And if you throw strength training in there, it's around 20%. And if you throw aerobic and strength training and flexibility or stretching program, it's less than 15% are meeting those basic guidelines. So, which is kind of alarming, and knowing that we as a society know that physical activity and exercise is a great form of prevention and will ultimately help us age slowly. So what is physical activity? What is exercise? Physical activity is defined as any movement that produces a contraction of the skeletal muscle that increases your energy expenditure. So basically anything and everything you do outside of sitting and sleeping that you have to increase your energy level to complete that task. So physical activity is that broad topic. Physical activity encompasses anything and everything you do throughout the day, where exercise is more specific to a set group of activities that you do to improve one or multiple physiological, psychological aspects of your health and wellness. How active are we supposed to be as far as physical activity? Physical activity, it is recommended that, and here's, you can see the recommendations for adults. Adults, it is recommended 10,000 steps, older adults 6,000 to 10,000, children 12,000 to 16,000. If you're looking at weight management, we're recommending that you attain 12,500 or more. The problem is the average person in the United States is getting around 3,000 to 4,000 steps a day. And this initiative, the 10,000 step initiative, goes along with the basic food label. So if we're, for example, if I'm eating 22,000 to 2,500 calories, the average adult needs about 10,000 steps to maintain or utilize that energy that they're taking in through food and not leaving that excess energy, which will ultimately turn to fat. So it's kind of, you know, there's always that debate, is 10,000 enough? Is 10,000 too much? To answer that, everybody's different. And what works for one person doesn't necessarily work for another. For example, you know, I could be eating 2,000 calories and taking 10 to 12,000 steps a day and maintaining my health or maintaining my weight, where somebody else could be eating, you know, 2,000, 2,500 calories a day and taking 10 to 12,000 steps and gaining, you know, 10 pounds in 2 months over the holidays. So, you know, it's all a matter of the individual, and really the biggest part of steps, step counting is more or less finding out what works for you. On the other side, you know, the great thing is that exercise is part of those steps. So if we're recommending exercise or we're recommending 10,000 steps, the great thing is everything you do as far as your exercise program is part of that 10,000 steps that you're trying to attain or striving to attain. And the current recommendation for exercise is, as far as aerobic, and aerobic would mean anything you do that you increase your heart rate and keep your heart rate up for that 30 minutes. So the recommendation is 30 minutes of low to moderate cardiorespiratory activities 5 times, if not every day. As a diabetic, I personally, when I talk with the diabetes education classes here at Hanover, I recommend every day. I tell people to strive to do 30 minutes every day. That doesn't mean you have to go to the fitness center 7 days a week. What it does mean is maybe you are going to a fitness center or you're going to a program 3 days a week, and maybe 4 other days you're maybe going for a walk. So basically what we're just trying to do is to be more consistent with our management of our blood sugars with that by recommending it every day. The more benefits, obviously, that, you know, if you can attain 150 to 210 minutes a week is great. If you can attain more than 210 and up towards 300 minutes a week, that's even better. The research shows us if we're attaining 300 minutes a week, we're doing everything we possibly can to manage our diabetes, manage our risk for other chronic health issues. Strength training, free weights, body weight exercise. Great thing about COVID, or one of the great things that come about COVID, is we've gotten creative. We've gotten to think outside the box. So we're back to doing stuff at home. We're using body weight exercises. We're setting up gyms at home. We're making them much more accessible for us. So strength training, where people thought it was unattainable, are now exercising again, and they're doing this stuff at home through push-ups, sit-ups, squats, lunges, those type of activities. So the great thing about doing strength training is you can do maybe 6 to 8 exercises 2 to 3 times a week and get a great maintenance program. We tell people 2 times a week for maintenance, 3 times a week to improve your overall strength. Flexibility, another thing that we recommend that people just do not do a whole lot of. As I mentioned before with the statistics, flexibility is anything that's a gentle stretch that puts your joints through a basic range of motion. I tell people, and we recommend here at our fitness center, we recommend to do your flexibility, your stretching programs as your cool down. So where you're warming up prior to exercise, take that 2 to 3 to 4, even 5 minutes to do some gentle static type of exercises. Some people maybe like these type of exercises a little more and go towards or move towards yoga, Pilates, those type of activities. But it really is a matter of just doing something at the end of an exercise program or some type of stretching program 2 to 3 times a week will help maintain that range of motion in those joints. So what's keeping you from exercise? Here's some basic statistics as far as what keeps people, the average adult, away from exercise. And as you can see, work, family obligations and lack of time, which kind of coincide with each other, are your highest percentage. Then you got other priorities, level or energy level, weather, lack of motivation, stress, physical limitations. So, what we may think as physical limitations as the one thing that really keeps people away, it's really the lowest thing that's keeping people away. And it's more about, making physical activity and exercise a priority in your life and working it in with your family and working it in with your time and working your schedule around that. So I kind of break these things down and kind of give suggestions through with lack of time and monitoring and social support and lack of energy. The biggest thing, to me, with all of these things, with barriers, if you don't like it and you don't like who you're exercising with, you're not going to do it. So surround yourself, find something you like to do, even if it's for a little amount of time a day. Schedule it into your day, and you'll be more likely to stick to it. Some of the other things are lack of resources, weather's a big one. Knowing that it's going to get cold, and I know most people don't like to walk on the treadmill, but the treadmill is a great alternative to exercising when it gets cold outside. Travel, family, obligations we talked about, retirement. I haven't met or I haven't seen a commercial lately that did not about any type of retirement that didn't include active living or active lifestyle. So it's a big part of retirement, and you want to find these things that work for you. Tips to leading an active lifestyle. First and foremost, you always want to start with your physician. And when you start with your physician, you want to find what exercise is best for you. Not every program is best. It works for everybody. But then on the other side, there's some that like to try a lot of things. So it's really about trial and error and really looking at your situation and finding what works best for you. Getting support from your friends and family. If you don't have the support from your family, unfortunately, it will become not a priority. If you're constantly getting hassled about going to the gym or taking a bike ride or going for a walk or whatever from your friends and family, unfortunately, you'll push it aside eventually. So include your friends, include your family in your exercise programming and going to the gym and going for walks and bike rides and everything. Start slow, plan ahead, always be safe. As a diabetic, you want to always make sure you are exercising roughly 1 to 3 hours after a meal, just because your blood sugars are a little higher. Make sure your shoes are appropriately fit. Make sure you're wearing good socks. You don't want a whole lot of moisture around your feet. You always want to bring a snack. Have an ID bracelet if you're a diabetic. Checking your blood sugar is critical. If you're below 100 before you exercise, make sure you have a snack or you eat a snack before you start exercising, and then recheck it again to make sure it is above 100. If you're 300 and above, maybe it's not a good time to exercise. At 300 and above, we start thinking that there could possibly be ketones in your bloodstream, which are basically a form of your body uses those ketones to break down fat for energy. And it's not necessarily a good situation because your insulin control is not, or your your insulin, your blood sugars are not well controlled when you're in 300 or above. And be safe. If you take insulin 6 to 12 hours after exercise, you are at increased risk of hypoglycemia or low blood sugar. And we talked about this, adding more steps to our routine. One of the things I want to just kind of leave with or finish with here is this is nothing new. Physical activity and exercise is still the best medicine. This was written in 370 BC. Speaking generally, all parts of the body which have a function, if used in moderation and exercised in labors to which each is accustomed, become healthy, well-developed, and age slowly. But if unused, left idle, come liable to disease, defective in growth, and age slowly. It's so true. Our body is meant to move, and more things negative happen to our body if we are leading a sedentary lifestyle. I've given you some basic resources here, from success stories to college athletes, to famous people with diabetes, this is a really good 23 and a half hours. It's a little short little video. Same with the exercises, medicine, some the basic position paper, and then your ADA and your American College of Sports Medicine with as far as exercise programming and diabetes. I'm going to finish with just saying that everybody's different. What works for one person doesn't work for everybody. It's a lifetime commitment. So remember to start slow, listen to your body, build on little successes, and have fun. And just remember that, the more we do, the better we are as far as physical activity and exercise. Thank you.
Thank you so much. And we have one question here from Jill. She asked, if a person had to make one change, what would it be? What would you recommend that one change be, both exercise standpoint and nutrition standpoint?
That's a great question. I can answer the exercise portion. If Denise is still there, she can answer that other section if she's.
I'm still here. I'll answer. Right. I'll let you go first, Brady.
What I would change is just the physical activity. I would look at your overall physical activity. I would add a pedometer. I would do a step counter. The pedometers are great tools because they really help not only give you an awareness of how active you are, but they give you a way to motivate yourself, and they become a little more accountability. So at the end of the day, if I'm at 4,000 steps and I know I need to get up to that 8,000 or 10,000, what I should be getting, it just kind of says, okay, let's get moving at the end of the day. I may be at 4,000, but maybe I need to go take the dog for a walk and get a little extra steps. So I would say one of the best things, and the one thing that I would do, is add a Fitbit or some type of pedometer step counter to your normal lifestyle.
And from a nutrition standpoint, Since a lot of times people feel like making changes in their diet involves restriction, I would say adding more non-starchy vegetables to the diet would be a good place to start. It's an adding of things, not taking away. So looking at adding more non-starchy vegetables like the broccoli, cauliflower, zucchini, it's a good way to fill you up, a good way to add more fiber, a good way to add more vitamins and minerals, and also a good way to reduce fat in your diet. So I'd say add more non-starchy vegetables.
Oh, excellent suggestions. And yes, the Fitbit, I just got one myself about a week ago. I haven't had one for a few years. I just got a new one, and I think it's already a little disappointed in me. I'm not quite reaching my goals this week. It's been a little bit of a hectic week. So I got to get on that. But yes, it is definitely motivating, and lets you know when you're falling a little short, which is nice. And lots of other interesting features too. It checks heart rate and sleep patterns and all sorts of interesting
It
stats.
is pretty cool what the newer Fitbits and the Apple Watches and the Garmin's, and they have, you can do an EKG, you can do pulse ox, you can do GPS where your hikes are. There's some really cool watches. I actually broke mine about 2, maybe 3 weeks ago, and I absolutely feel naked without it. I feel like I'm really missing something. Because I like to kind of see what I do on a regular basis. Just a great thing is statistics show that just putting a pedometer on, you walk 2,000 more steps a day. So that's huge. That's a mile, so for any average walker.
Yeah, and it definitely recognizes some of the time when you're active and you don't even realize.
Correct.
That a lot of it counts. A lot of small things can sort of add up. Yep. It doesn't always have to be big long exercise sessions that can count.
That's correct.
So anyway, thank you,
You're
Brady,
welcome.
Denise. Any other final thoughts before we head out? No, we're good. Okay, well, thank you, Brady, Denise. Thank you all so much for joining us today. We hope you took some great information away from today's event. And we'll also be posting, we were recording today's session. We'll be posting and recording this on our American Heart Association Eastern States YouTube channel for you to reference later. That'll probably go up probably around tomorrow. And a final thank you to our sponsors, UPMC, of course, Encompass Health, Traditions Bank, Visiting Angels of York, and the Markets at Hanover. Another reminder, don't forget to follow us on social media. We're at AHA Pennsylvania on Facebook, Twitter, and Instagram. There's more local events going on, more happenings, including our final wellness webinar in this series. It's all about seasonal eating on December 9th, so we hope you will join us for that. Thank you all again so much for being with us today.